Dr. Martha Whyte is the regional director for the Louisiana Office of Public Health. Hey, Dr. Martha, thank you for taking time for us this morning. Good to see you. Hear you.
Good morning.
Erin, are you back yet, or are you still rebooting the box? She'll be just a couple of seconds. I don't know if you've been listening or not. Our various symptoms, as we were both COVID positive, the various symptoms, or more specifically, lack of symptoms. Is that surprising to you, or is that sort of the majority of folks?
It's not surprising. A lot of people are asymptomatic completely. Y'all had a few symptoms. Some people have none. Problem is, it's like Russian roulette. You don't know whether you're going to be like you guys or you're going to be in the hospital and really sick or even pass away.
Now, there's some folks that we know who are also positive. And I was told this by a couple of doctors, Erin too, that there's like a second, I don't want to say second phase. You get to days 4 or 5 through 8 or 9. And that's when you really have to be concerned about lung infections, congestion, etc. Legitimacy to that, right?
That's true. There are some people who will see, a worsening of symptoms or even a return of symptoms kind of in that second week. And those symptoms tend to be worse if that happens to you. Of course, whenever you have shortness of breath, it's something that you have to take very seriously because that can progress pretty rapidly. And so you want to definitely see your physician, or if it's in the middle of the night, go to an ER or quick care because it's not something that you want to ignore.
Dr. Whyte, let me ask you this. There are a lot of people that are wondering, when can we come out of isolation? What are the rules with regard to that? What do we need to do? What do we need to be? We need to be symptom free. What's the rule?
So if you're an actual case, like you two are, tested positive, you have to stay in isolation for 10 days. You can come back to work after those 10 days, as long as you're afebrile, no fever, for at least 24 hours, and that your symptoms are improving or gone. Now, some people will keep a little cough, or a lot of people will have fatigue, and if they've lost that sense of taste and smell, that can remain for some time. So you don't have to be completely well. Those can kind of linger, but you have to be definitely improved and no fever.
So we are no longer contagious probably at this point.
If you're 10 days out and no symptoms, you're correct.
Okay.
Doc, when do you start the count? From the first symptom, which for me was a scratchy throat a couple of weekends ago, or from the first day of fever?
So we say to start it from your first symptoms. Some people don't really realize when that might be. And of course, if you just had a mild scratchy throat and it went away, if it hung on for you, Robert, then that would be your first day and you would start counting from that day. Some people don't have a whole lot of symptoms and will start from their test. But other than that, if you know your symptom date, that's when we start it.
I've got another one for you. Our producer, specifically Ruben, you know the room we sit in. He's tested negative all along. Is he good to come back at 14 days?
Correct.
Okay, so Monday he's cleared.
Correct.
Let me ask you one more thing about this. I'm a little worried about this fatigue and possible long-term impacts of this. What should I be concerned about with regard to that? Is COVID going to have any permanent implications on my life, Robert's life, and others who are dealing with it?
So that's a good question. We don't know how long the post-COVID syndrome can last. People are having significant issues with fatigue, issues with what they call brain fog, where you not necessarily are confused, but maybe you have difficulty multitasking, staying focused. If you get pulled, your mind gets pulled in another direction, you might not be able to do that the way you were prior to COVID. And then we even have some people who have some neuropathies, nerve issues, muscle weakness, almost like a Guillain-Barré type syndrome after COVID. So there are a lot of things that are hanging on. There was just a study that came out. There's a lot of depression and PTSD for some people who were really sick. So, yeah, it's not as benign an illness as we all want to make it out to be if you've had it.
Erin she is dying to ask you this, and it may have slipped her mind because of her increasing brain fog. Go ahead. Take the next.
He's going to pick on you about that forever, huh?
Ask her about your weird dreams.
Martha, I'm having some crazy, bizarre dreams, and I'm not one of those people who ever remembers my dreams, but now I am. Is that really a thing?
It can be. You're not the first person I've had ask me about that. So I haven't seen any studies that have mentioned that, but I do know a lot of people have talked to me personally about that. So anecdotally, I would say yes, that could be connected to your COVID.
And the fact that the victim of her violent outbursts in her dreams is normally a tall, slender, elderly man with little hair, is there anything that I should be worried about specifically?
Just don't wake her up suddenly.
I do have a question for Erin and me. Although you had mentioned a couple of times that it's not required after 10 days or whatever the isolation period is. You had mentioned that a negative test was not required. Would you recommend one just for not necessarily our peace of mind, but to help relax everybody we know, including coworkers?
So CDC actually went away from requiring those tests because there are some people who will retain, it's hard to describe, but it's called viral particles. It's not infectious material, but it's just pieces of virus that will test you positive on a test. We have people who have tested positive up to 60 days after they've recovered. So they were held out of their work. The CDC has gone away from that recommendation. As long as you are improving and you're not febrile and it's 10 days out, we say go back to work.
Is sort of fever-free the bar for that? Fever-free, what did you say, 24 hours without Tylenol, ibuprofen, whatever it happens to be, right?
That's correct. And you have to be improving. You know, some people never have a fever, Robert. So if you have a significant cough and it's getting worse or it's really staying the same level of severity as it was when you felt the worst, you don't want to go back to work yet. Give yourself a chance to heal and feel better. If you have a little nagging cough that's just kind of hanging on and every once in a while you get that scratch and cough a little bit, that's okay. But we don't want your symptoms severe or worsening.
Erin, time for one more.
Dr. Whyte, I obviously now will have the antibodies. Is that still needed? And are you interested in having folks like Robert and I come and donate our antibodies?
It's very much needed. And, you know, you saw that drug that's just been approved for emergency use, that monoclonal antibody. That's going to be something that's a game changer as well. But antibodies, I'm going to tell you, saved my husband's life. So if you have them, go and donate your plasma. It's very simple to do, takes 30 minutes, and you really can make a difference in someone's life.
One more question from me, too, and thank you for your time, Dr. Martha Whyte. The news of the last, say, week to 10 days, maybe a little longer, the Regeneron trials, the Pfizer 90% effective vaccine. After everything, the tough times you've seen over the last 3, 4, 6 months, you have to be more than a little encouraged for what lies ahead as we approach 2021, right?
Very much so. You know, we've been saying since you and I first started talking that was going to be the biggest game changer we could see is a vaccine coming out. But we have to get people to be willing to take it. It's important that we get. Everybody has asked me forever about herd immunity. We're not going to get it without taking this vaccine.
Masks
or it'll take a long time.
Masks for folks like Robert and I, we've already had it. That my mask is supposed to protect you. Do I still need a mask even though I can't pass it anymore?
So, technically, no, you don't have to wear a mask. People don't know, or, you are famous, and so people might know that you've had it. But, my husband, for example, he wears his mask because people don't necessarily know that he's had it, and he wants to set a good example.
I had COVID. All I got was this T-shirt. Dr. Martha Whyte, Regional Director, Louisiana Office of Public Health. Thank you, ma'am. Great stuff as always. We appreciate it immensely.
I'm glad y'all are both better.